Hi, welcome to the brand new episode of You Diary. One of the most important vital organ in our body are kidneys. They are considered as a sophisticated reprocessing machines which cleanse the toxins out of our body. To discuss further on this topic, we have with us Dr. Sooraj, consultant nephrologist, Renai Medicity, Cochin. Welcome, Doctor, to our show.
Like we all know, the urine is produced by the kidneys and it washes out a lot of waste materials and toxins from our body. In addition to production of urine, there are many more endocrine functions like formation of vitamin D3, and sometimes you won't be able to get it from the bed also. But the other side of the coin is that the kidneys' functional capacity is so huge. So sometimes only when you get about 80 to 90% of damage, you will get symptoms. And sometimes when you have symptoms and when you go to the doctor, it may be too late.
Okay. Doctor, in between you talked about dialysis. What is dialysis?
Yeah, dialysis is a kind of kidney support. So it replaces the kidney function. That is, it is known as a renal replacement therapy. In this cases, we put a catheter into the abdomen, infuse a specific fluid into the abdomen and remove the fluid after a specified period of time. So this is done at home, and the patient has to come for work only once, come to the doctor only once a month or so.
So you mean to say that peritoneal dialysis are easy to do and have a are better when compared to hemodialysis?
No, that is not true. Peritoneal dialysis, the advantage is...
No, how do you actually differentiate? I mean, which patient should go for hemodialysis or which patient should go for peritoneal dialysis?
The other thing is, you will have to have pricks, means you have an AV fistula and thrice a week you have to suffer the cannulation. But the advantage is that you are coming to the hospital thrice a week. So even if you have a small problem, you will be able to deal with the doctors and tell your problems to the staff there. So you will be getting much more medical attention than a peritoneal dialysis in the urine. So if that is the case, then we will have to do something known as a renal biopsy. So usually when you say biopsy, people will think, oh, this is something like a cancer and it is some sort of a very serious matter. But the contradictory fact is, in case of renal cancer, usually you don't do a biopsy. So it is usually contraindicated, and only in very select conditions you do a biopsy because in case of a renal cancer. Yeah, chance of spillage. So why we do a biopsy in a renal disease is to find out what is the microscope collect their urine. For them, protein creatinine ratio is much better.
Okay, doctor. Now let's go to the next question.
Hello, doctor. My name is Praveen. I am from SVN. My question is, what is renal transplantation?
So like I said earlier, so renal transplantation is a type of renal replacement therapy. So we are replacing the function of the damaged kidney. So renal transplantation is the ideal renal replacement therapy kidney. Or if you want to get a kidney from somebody, so you call them the donor, and the person who receives the kidney is the recipient. The donor has to undergo numerous tests. There are about 30-40 tests for the donor to undergo, and we have to make sure that the donor is fit for undergoing the surgery and that they won't be having any future problems. There are data for about 50 to 60 years, and it has been found that donor does not have any certified as a cadaver. So related transplant has got better survival when compared to unrelated transplant. But nowadays with better medicines, even unrelated and cadaver, they are also doing well. So the success of related transplant is because you have a chromosomal match. So like you said, so because of the match, their chances of rejection is very less. So after transplantation, so you will have to take medicines for lifelong. So nowadays you have this Kerala network of organ sharing or Mridha Sanjeevani. So we would have all read about that in the paper. So this is an organization by the Kerala government. So they did not want to waste organs from multiple, because one person can give 2 eyes, 2 kidneys, a heart, 2 lungs, liver, intestines. Yeah, they can save at least 10 to 15 people. So if they are willing to donate. So instead of like you say, ashes to ashes, dust to dust. So instead of wasting all these organs, so government thought, why not we have an initiative to save lives of many people, and it has taken off in a big way. So if somebody is willing to donate, then they will contact this KNOS and they will make necessary arrangements and they will do the matching and they will allot. It is a very transparent process, and so far there has not been any controversies regarding that.
Okay, doctor. Now let's go to the next question.
Diabetes at an early age. So studies have found that when you reduce the weight, so the chances of kidney diseases also come down in obesity. So in addition to that, a large amount of meat has been shown to cause an increase in the uric acid. So this causes what is known as hyperuricemia. So this can deposit in the kidneys and lead to a large